right, thank you. Thank you. So quiet. Thank you all. You were all very quiet while they came in, and please feel free to have a seat. I'd like to encourage you all to, as we go through this process, definitely cheer one another on and cheer on the people that you're proud of. They have accomplished very much to make it here tonight, and this is definitely aimed to be a celebration of that achievement. Good evening, everyone. I'm Valerie DiGregorio. I'm one of the Associate Program Directors for the Physician Assistant Program. And on behalf of our Senior Dean and Dean of School of Health Professions, I am happy to welcome you tonight to this very special occasion. This evening, we're here to acknowledge all the hard work and dedication and the sacrifice that these people have earned to progress to the clinical year of training prior to entering their physician assistant profession. There are several milestones in the rite of passage from PA program applicant to a new entry-level healthcare provider. And each of you here tonight has attained several of these milestones, and it has been our privilege as a faculty to watch you grow through these. Tonight is our opportunity to recognize all of your accomplishments. First, I want you to take just a second, though, to look towards the people in the room for our learners and thank all of the people who have supported you through this process. I am sure there have been many phone calls, supports, meals that have made all the difference. So just take a second to thank all of those people who showed up for you. You can clap for them too. Our goal is definitely lots of clapping and cheers. The white coat is recognized as an indicator of the membership of a caring profession, and it emerged in the early 1900s as a symbol of our new developing knowledge and skills and the adherence to rigor and exactness of practice. This evening, it is viewed as a step forward in the professional development of our learners. For our PA program, the white coat ceremony constitutes the rite of passage from the classroom into the clinical setting. It signifies our learners' readiness to assume additional responsibility and challenges associated with caring for others on a day-to-day basis. To begin, and with that background in mind, I'd like to introduce our first presenter, Sydney Levine, Class President of 2025.
Hi, everyone. Thank you so much, Professor DiGregorio. Good evening. 13 months ago, my classmates and I sat in these chairs, anxiously listening to our didactic year orientation. We were filled with excitement, nervousness, and did not know what journey was ahead, nor the challenge we would each face, the friendships we would make, the memories we would make, and the times in which we surprised ourselves for overcoming different obstacles that fell in our way. We have navigated the complexities of didactic year, challenging ourselves daily to learn and grow, and we're here. We made it to the finish line. Today marks a pivotal moment in our journey, a moment where the culmination of 13 months of rigorous academic pursuit, countless hours of studying, 100 assessments completed, and unwavering camaraderie amongst classmates is recognized and celebrated. Yet, we did not get here alone. We are here today with the support and aid from Baylor faculty and staff, friends, family, and loved ones. To our faculty, the invaluable support and guidance you provided to us was a gift. Thank you for inspiring us to reach higher and strive for excellence in every aspect of our education. You have challenged us to think critically, to question assumptions, and to uphold the highest standards of patient care. Your dedication to our education has been a beacon of inspiration, guiding us through the complexities of all different topics of science and preparing us for the challenges that lie ahead. Your commitment to our success has been steadfast, and for that we are immensely grateful. Equally deserving of our gratitude is our family and friends. Thank you for standing with us through this demanding journey, offering unwavering encouragement and understanding during the inevitable ups and downs. Thank you for actively listening to our frustrations, anxiety, trials, and tribulations when we could not grasp, say, the brachial plexus or other complex concepts. You have celebrated our successes, lifted us up during moments of doubt, and reminded us of the profound importance of our chosen path. Your love, support, and unwavering faith in us has not gone unnoticed, and today we proudly share this achievement with you. As we look ahead to the next 18 months of clinical rotations, we embark on a new chapter filled with both challenges and opportunities. In clinics and hospitals, we will apply the knowledge and skills we have acquired to provide compassionate, evidence-based care to our patients. We will embrace the responsibility entrusted in us with humility and dedication, striving each day to make a meaningful difference in the lives of those patients we touch. The significance of receiving our white coats today cannot be overstated. This garment symbolizes our commitment to compassionate patient care, clinical excellence, and ethical practice. It represents the trust that our patients, colleagues, and communities will place in us as future healthcare providers. I asked the faculty a couple weeks ago if they could provide us with any pearls of wisdom to take as we transition into the clinical setting. And here are a few tips that our faculty gave us. Number 1, never forget your physical exam skills. Remember, is this the same as this? Is this the same as this? Find a way to show kindness to each patient, no matter how small the gesture. It can be very unpleasant and stressful for patients dealing with the healthcare environment, and you can vastly improve their experience by acknowledging their humanity. Take time with the patients because some of these people and their stories will stay with them forever. If you rush through it, you may miss some great opportunities to learn and grow. Do not be above emptying the trash, grabbing a blanket, or making a phone call if that is what is going to help the patients in the most way at that moment. Get comfortable with feeling uncomfortable. Take meticulous care of yourself and your community. Don't ever be afraid to advocate for your patient. Don't ever be afraid to advocate for yourself. And lastly, conduct yourself in an ethical manner. Act with integrity, be honest. If there is something that you do not know, and there will be several things, then state it. If there is an important question you forgot to ask when interviewing a patient, acknowledge it. And if you make a clinical mistake, admit to it. Do your best to correct it and learn from the experience. The responsibility entrusted to us is immense, but so too is the privilege of serving others during their times of greatest need. Let us carry forward the spirit of compassion, integrity, and lifelong learning instilled in us throughout our training. Let us support one another as colleagues and continue to uphold the highest standards of healthcare delivery. And let us never forget the privilege it is to be entrusted with the care of patients. In closing, I challenge each of us to embrace the journey ahead with humility and dedication. Congratulations to my fellow classmates. I'm sorry I lost my place. On this remarkable achievement, our journey has just begun, and I am honored to walk this path alongside each and every one of you. As you head home tonight and reflect on all that you've accomplished, I want to leave you with a quote that to me represents the essence of our hard work and the importance of recognizing it. I encourage you all to embrace these words from Snoop Dogg. I want to thank me. I want to thank me for believing in me. I want to thank me for doing all this hard work. I want to thank me for having no days off. I want to thank me for never quitting. I want to thank me for always being a giver and trying to give more than I receive. I want to thank me for trying to do more right than wrong. I want to thank me for being me at all times. Thank you.
I don't think I can beat that. Thank you so much. I do say I want to thank you all for being you. You've got a great leadership for this class. And next, I'll move to introduce Isabel Valdez. She's our education chair for the Texas Academy of Physician Assistants. She also works really hard in precepting our students clinically and also teaching within the program during the didactic portion. So she supports our students in so many ways, and TAPA supports them as well. So thank you.
Really can't beat Snoop Dogg. I just can't. I'm trying really hard. I can't. Good evening, everyone, and thank you for the invitation to be here. You all know me as Professor Valdez, the IMOP lady, the diabetes lady. Yes, and I love my doxy. Everybody knows that. If you don't know that, know it now. But I am also today representing the Texas Academy of Physician Assistants as their CME and Education Chair. And I am honored to be here tonight to welcome you into this profession. Now, at TAPA, our mission statement is to promote and advance the physician assistant profession in Texas through advocacy, professional development, and engagement. Our vision statement is simple: create a thriving community of PAs, that includes you, who are leaders in healthcare, who are making an impact, a lasting impact on health and wellness of the citizens of the state of Texas. We are excited to see the gifts that your skills will bring to patient care, not only here in Houston, but also in the state. And especially if we can keep you, please. We work relentlessly at the state capitol every other year, in fact, next year, to make sure that your ability to do your job safely and effectively is done without any limitations. Imagine the excitement you have on your first day on the job, and you are told you cannot sign a prescription because your prescription's not valid. Let that sink in. Imagine seeing a very sick child in the ER, clearly suffering from strep throat. You know they got it. You got the positive screen test, and being told that the only person that can make that diagnosis is not you. Legislation like this threatens our ability to work with our medical colleagues, doctors and nurse practitioners alike. As you enter your profession, know that there is an army of physician assistants, some of them in this very room, who have worked to make this a possibility for you to do. Now, you are a busy bunch. That's an understatement, and I know we're going to keep you busy. I know you in IMIP. But I lost my place too. But I hope that you will join me and other TAPA physician assistants, in fact, some of them are sitting in this very room, as we work on our continued efforts to ensure that us as PAs can work in communion with other nurse practitioners and doctors in the state of Texas to provide lasting care that will help the healthcare of our state. In fact, if you want to get started a little early, you can. I invite you to the 50th annual meeting and CME conference that will be held in Arlington in September 12th to the 15th. Now, that aside, congratulations on this monumental day. Enjoy your time off, and I can't wait to see your clinical rotations. And one tip, the answer is always going to be doxy.
Thank you so much, Isabel. There are many role models for PA students throughout their education, but students often gravitate towards those who have recently come before them and recently enough that they can really relate. So to that end, we have an alum and also 2 senior clinical students who will talk with us this evening. First, I would like to introduce Alyssa Reed. After graduating from BCM's PA program in 2019, she's worked as a hospitalist in infectious disease at MD Anderson, and she has spent many hours mentoring students, whether it's through her PhD course or also in the classroom. So, Alyssa?
Good evening, everyone. I am truly honored to be here with you tonight. Reflecting on my own white coat ceremony at Baylor brings back such special memories, so it's truly a privilege to get to share in this milestone with your class. First of all, congrats. You have completed likely one of the most rigorous academic years of your life, and now it is done. You have spent countless hours in lectures, studying, mastering a 300-plus point physical exam, plus special tests. Shout out to DeSandro. And all of that hard work has led you here. And now you get to transition into clinical rotations and then into your career as a PA, where all of that knowledge is applied to your patients. It can be easy to forget at times, especially in the didactic year, when you're stressed with 12 plus finals in a week, about the people you will be engaging with on a day-to-day basis at the bedside. But now in rotations, remember that every bit of knowledge that you've gained will serve a purpose: to provide compassionate care, accurate diagnoses, and meaningful treatment plans that truly impact lives. My charge to you all is to always have the person that you are treating at the forefront of your mind. Let the patient and their care come first, and everything else will fall into place. One of our faculty members on our White Coat Day shared a simple yet profound piece of advice with our class that I haven't forgotten, and it was never forget to be kind. In a room full of really esteemed colleagues and educators, those words really resonated deeply with me and stuck with me throughout rotations and into my career. In the long term, treating others with kindness, no matter who it is, from the medical assistant in the elevator to the chief of surgery in the OR, really sets you apart and defines your character as a student and future provider. As you step into clinical rotations, you're embarking on a journey full of diverse experiences. You'll get to collaborate with students across disciplines, explore specialties that you may never see again, and participate in procedures and surgeries that you will remember likely for the rest of your lives. Baylor has prepared you to be a valuable member of these teams, and so both your knowledge and character are going to stand out in your rotations. Unlike most of didactic year, clinical rotations and then practicing as a PA gives you the beautiful opportunity of looking things up. Up to date will soon become a friend in your innermost circle if it hasn't already. And while your medical knowledge has exponentially increased in the last year, you will soon find in the clinical setting that there is so much that you do not know. Embrace that uncomfortable feeling of not knowing, and then look it up. If you don't know the answer, it's okay to be honest with your preceptor, but don't stop there. Keep learning and growing, not so you can impress others, but in order to help your patients. You have all done such a remarkable job this year, and I've had the privilege of meeting many of you and engaging with your class as a whole. And you're really a thoughtful group, so as you enter into clinical year and beyond, have confidence in your training, treat everyone with kindness, and maintain the humility of a lifelong learner. You will certainly represent Baylor and the PA profession well. Congrats once again, and I really look forward to seeing all the positive impact that you have on your patients' lives. Thanks so much.
Thank you, Alyssa. I'd like to introduce next Montrachet Worley and Arthur Ferguson, both third-year students who will graduate this December. Since they are completing their clinical year journey and that you are about to begin, they are here to share some clinical tips. So please welcome Montrachet and Arthur.
Thank you guys so much. Good evening, students, faculty, family, and friends. I've had the pleasure of getting to know many of you, but for those who don't know who I am, my name is Arthur Ferguson. I'm part of the class of 2024. First and foremost, I want to extend a genuine congratulations to the individuals we are all here to celebrate tonight. Let's hear it for them. What they have achieved in the last 13 months is nothing short of remarkable. Class of 2025, I am honored to stand before you today during this significant milestone in your journey as physician assistant students. As someone who was sitting in those chairs not too long ago, I want to share a few thoughts and tips from my experience about transitioning from didactic to clinical year. I can confidently say that Baylor has prepared you all for this next step. The rigorous curriculum, the dedicated faculty, and the comprehensive training have equipped you with the knowledge and skills needed to succeed. It's during this time that you will learn to apply this knowledge and fine-tune your critical thinking skills. Clinical practice is where your recent hard work meets reality. It's a dynamic, hands-on learning environment. During clinical year, you'll be making many transitions, working in a variety of fields and different settings, from the emergency room to the operating room, from pediatrics to geriatrics. You will learn what you guys like and also learn what type of provider you want to become. You'll learn about building rapport with patients, working in a team, developing treatment plans, doing fun activities like delivering babies, sewing up lacerations, assisting in codes, and many other amazing opportunities. You'll create bonds with patients that you'll remember for the rest of your career and life, because you're often meeting these people, these individuals, at some of their most vulnerable times. So it's important to remember that it's a privilege to serve those in need, and each interaction is the opportunity to make a positive impact on someone else's life. I promise you guys got this. And I also promise that clinical year is so much better than didactic. Yeah. I don't know about y'all, but I personally was ready to be finished with didactic. Not only for more free time, but more sleep. Like a lot more sleep. But really, I was excited to get my head out of the books, and I wanted to interact with patients and apply all my hard work and knowledge into the real life scenarios. This might sound daunting to y'all, but just look back at everything you've already accomplished. For example, I vividly remember my first day, like my first lecture in PA school. It was CMD. They managed to condense a whole undergraduate biology course into a 2-hour lecture. I remember how anxious and overwhelmed I was, and I was like, there is no way I'm gonna make it through this year. Another time, I'm sure you guys remember as well, is when we first received the comprehensive physical exam checklist that first week of PhD and were told to memorize it. For those who don't know what this is, during the first week of PA school, they hand you this 11-page front and back list, 323 steps, and in 6 weeks, not only do we need to have it memorized, but be able to perform it correctly with the right technique in front of a faculty member while being timed. Oh, and there's also 10 other exams that occur that same week. So even though it seemed impossible at the time, you guys, when it came to the test, you guys all did well. And just like that one challenge was presented to you during the first term, since then you have been tested, and your resilience has been tested countless times, and each time you guys have persevered, and now you guys are all here today. So I know you guys are ready for clinicals, and I hope you guys know you are too. So don't worry, your preceptors don't expect you to know everything. Some don't expect you to know anything at all. What they do expect is your willingness to learn, your dedication, and your effort. They are there to guide you, to teach you, to help you grow. Don't be afraid to speak up and ask questions. You are there to learn. Plus, you're paying them a lot of money. You deserve to be there. You might not always feel like it, but you are a valuable member of the team. It is completely normal to feel like you're not ready. Trust me, I still don't feel like I'm ready. And truth is, you might never feel 100% ready, and that's okay. What's important is that you are well prepared and you remain committed to lifelong learning. You have the tools, the knowledge, and the support system to make the most of your clinical experiences. Every person in this room tonight is here to support you. They're your allies in this journey, whether it's to clarify a concept, seeking advice, or just lending a listening ear. Never hesitate to reach out and lean on your faculty, family, and friends. Today, as you don your white coats and transition into this new phase, embrace the challenges and celebrate the victories, no matter how small. Be proud of how far you've come and excited about how far you are going to go. Good luck to each and every one of you. You've got this. Thank you.
Alrighty. My name is Matrashe Worley, and I am also in Arthur's class. In the book, Come Matters Here, the author writes, life isn't about the destination that we could boast about getting to. It's about the walking in between. It's the in-between stuff that fleshes out a story. It gives us guts and transformation. It's a phrase indicating that the dotted line on the map is just as important as the destination. Today marks a milestone for you all, a pass and go and collect $200 on your journey through this program. Didactic is over. Enjoy today with those next to you as you don the symbolic white coat and celebrate with all the friends and family who have traveled near and far to commemorate you. Let the wave of accomplishment and relief wash over you. You can finally give your laptop and iPad a break, and you can lay off the Celsius for a while. When the era of vacation and relaxation starts to fade, and when the all too well known anxiety or stress starts to creep in again, know it's normal, and that you are more than prepared for this next phase in your journey. The first day of my first rotation was held just down the street at the VA in IMIP, which you too will come to know and love. Once acclimating to the labyrinth that is the VA, I met with my team, which was hosted by an attending, upper-level residents, interns, and fellow med students. Expectations were laid out, and I was instructed, go round on your patient. Round. Round is a shape. It's not an action that I know how to do, but I'll let you in on a secret. The gold standard of clinical rotations is never be afraid to ask anything, ever. I leaned over to the intern, what does rounding look like? And for those of you on the edge of your seat wondering, rounding is asking your patient how their night was, how they enjoy the hospital food, how they enjoy the weather, how they slept, and then assessing any changes by performing a physical exam. Then rushing to your team room to fumble through CPRS, the ancient electronic record the VA uses, to compare blood counts and electrolytes from the day before. So I rounded on my first patient. He was an elderly veteran, as most patients at the VA are, who was in severe liver failure. Like many other patients, he came to Houston to seek care that his little Louisianan town could not provide. He had already been at the VA for over 10 days when I met him, and my impression was, wow, this man is sick. His legs were swollen to the point that his skin was tearing and fluid was dripping all over his bed sheets. A real picture of what pitting edema looks like. His lungs sounded like Velcro, crackling, filled with fluid. A real sound of pulmonary edema. His palms, his gums, his eyes were yellow. A textbook image of jaundice. With one physical exam, his body brought to life months of information, solidifying and personifying the definitions and diagnoses that I had previously turned into flashcards and study guides over the past year and a half. I spent 2 weeks with my liver failure patients, sneaking him a Coke Zero with approval of my attending here and there, attempting to give him a break from the hospital life that he was held captive to. He told me about his wife, whom he had been married to for over 50 years, his multitude of grandchildren, about his time in Vietnam, and most abundantly about his prayers. When reflecting on my time as a clinical student, stories like this flash through my memory. Answering anticipatory guidelines about a 2-week-old newborn to a 15-year-old mother, the tiny little baby sleeping away on the exam table wearing an Astros onesie. Learning how to do an ENT exam on a child who is nonverbal and had shoved a piece of couch cushion up his nose 3 months ago. Assisting with a huge skin graft on a patient who had necrotizing fasciitis, and I'm talking from his knee down. We are able to save his leg and preserve his function. Explaining through a phone translator how Harris Health can offer the gold card to a Syrian man who needed a refill on his anti-rejection medications but had no way to pay for them. Holding the leg of a woman as she gave birth to her 7th child, and even though we could not speak the same language, her expression and gratitude showed on her face as I left the room. Retracting during a surgery while watching as the donor tissue of a kidney pinks up when the clamps are released and the blood of the recipient brings it new life. During clinical year, you'll be at the epicenter of learning. You'll see diverse populations of patients and a multitude of diseases. You'll be faced with diagnostics and treatments. You'll solidify your interviewing and physical exam skills. You'll expand upon your differential diagnosis and treatment plans. You'll learn how to provide education, talk with families, and learn a system as a whole. But above all else, you'll be offered an opportunity to provide compassion to the people that matter most. With my parting words, I'll leave you with this. Every day, wake up and be where your feet are. Know how much you matter. Know how much it matters that you're here. Know that there are patients who need you, and know that these white coats are just one step towards the destination, and the trail on the map ahead is so much sweeter. Thank you.
Thank you both so much for sharing. Mentorship, guidance by, and teaching from a senior clinician are privileged moments for us all in medicine, and our honored speaker tonight has contributed much to the education of you all as future healthcare providers. Dr. Janae Atkinson is Associate Professor in Department of Family and Community Medicine here at Baylor College of Medicine. She received a Bachelor of Science in Mathematics from Spelman College in 1994 and Master of Science in Epidemiology from the University of Washington in 1997. After graduation from George Washington University School of Medicine, Dr. Atkinson completed her family medicine residency at Baylor College of Medicine. In addition to her clinical work as primary care physician within the Harris Health System, she is also actively involved in undergraduate medical education. We are very lucky to have her as our medical director for the Physician Assistant Program, and she has taken an active role for us as the director of our Cultural Competency course. She served in a leader in the Faculty Senate and also as an ambassador for the Diversity and Inclusion Council. Please welcome Dr. Atkinson.
All right, good evening. I think I'm like the last person between you and your white coats. So I want to start by saying welcome to friends, to family, and most importantly, well, to our esteemed faculty. We wouldn't be here without you. And most importantly, to our students. I'm so excited to see you guys here today. With that, I want to start by saying, when I was thinking about what to speak about today, I was actually sitting in my air conditioning deficient home for about 7 days due to Hurricane Beryl. And with that, guess what? My inspiration for this speech came to light. Because when I thought about it, I really thought about how much a hurricane really, in a lot of ways, is similar to the practice of medicine. So as I reflected, I found, and I just lost my place. I said to myself, really, how do these things really connect? And when I thought about it, I said, well, if we think about a hurricane begins as a small disturbance out maybe in the Gulf or somewhere, and it slowly starts to gain momentum, eventually becoming a formidable storm, right? And in many ways, our educational journey is the same thing. At some point, you had a small interest, and that interest became a larger spark, and then it became into a passion to learn more about medicine, to heal others, to really try to make a difference. When we think about a hurricane is unpredictable. They could change in their direction, they could weaken, they can become stronger without any type of warning. That practice is similar to medicine. You will encounter situations where the path is really uncertain, where patient conditions can rapidly change, and where the unexpected can occur. Your training will prepare you to navigate these challenges that you will encounter. And you'll be able to navigate them with skill and with grace and with resilience because of how you have prepared yourself for this moment. Then there's the eye of the hurricane, that place of calm, right? Well, I encourage you to find your place of calm, right? Because there are going to be times when there'll be chaos around you. You'll be in the ER and there's all type of emergencies going on. But it will be your place of calm, your ability to be able to keep that calm and reserve that will not only help to guide your colleagues, but will also bring calm to your patients. Your calmness will be seen as a source of strength. Now, a hurricane, the impact of a hurricane, as we all have seen just with Hurricane Beryl, some of us have been through this more than once. The impact can be vast. It can impact many different lives. Similarly, your work in medicine will do the same thing. You will have wide-reaching impact on the lives of the patients you see, on your community, and you will also, I'm sorry, you guys, the care that you extend beyond the walls of your hospitals and your clinics will also influence, and I'm sorry for one moment, just turn this over here. Your influence will be felt in the wellness of your patients and the care that they provide. As you don your white coats today, remember that this garment symbolizes more than just your professional role, that it represents your commitment to lifelong learning, your ethical practice, and compassionate care. The white coat is a beacon of hope and trust for your patients. It signifies your readiness in the face of challenges of the healthcare field, and just as a hurricane, it signifies you are ready to brave that storm. And I should say, just as a hurricane hunter or someone who follows a storm. In the aftermath of a hurricane, communities come together to rebuild and to heal. In your practice, you will be part of a larger healthcare community. And that means that your collaboration, your teamwork, and your support of your community will also do the same thing. It will be essential that you're a team player. Just as no one faces a storm alone, you will not be able to tackle the challenges that you encounter in medicine alone. So lean on your colleagues, seek advice from your mentors, and also get support from one another. So Hurricane Beryl eventually subsided, it dissipated, and the lessons that we will learn from this storm will endure. Similarly, the challenges that you will face and that you will encounter, you will overcome them, they will pass, and the lessons that you learn will stick with you for a lifetime. Your dedication, your empathy, your resilience will leave a lasting mark on the world of medicine. As you take the next step on your journey, I encourage you to embrace the spirit of the hurricane, the strength, the adaptability, and the profound impact. Remember that you have the power to navigate all of the challenges and uncertainties that will come your way, to find calm in the midst of all the chaos, to make a difference in the lives of those that you serve. Congratulations, students. Wear your white coats with pride. Step forward with confidence, compassion, and the knowledge that you are prepared to enter or to encounter whatever the storm may bring your way. Thank you.
Okay. Thank you, Dr. Atkinson. We are very grateful for your support of the program. At this time, we are going to move forward with the coding of the students. So Every year, the Texas Academy of Physician Assistants provides pins. The students will receive those. And also, the Office of Alumni Relations provides these new coats for the students each year. And I believe we have Annie Song from the Alumni Affairs attending tonight. So Annie, if you're here and can stand to be recognized, please. Thank you very much. Would the faculty members and the senior students please come forward to assist with coding of our students? Okay. Would the first row please rise and stand? Okay. Good. I ask that each of you come forward when I call your name, and as you leave the stage towards your seat, the faculty will present you with pins for your coat. Okay. Presley Babb.
Pardon me, everybody. I'm going to change this. Sorry. And it's because of that camera right there. Let's put it right here. No more this way. Here we go. Hold that. One more.
Donnelly Barrera, sorry. Emma Bowski. Brenna Brown. Christian Campos. Ernesto Casillas. Zachary Cruz. Callie Dalrymple. Michael Eggum. Abigail Frank. Umera Avor. All right. Will the second row please rise? Samantha Hernandez.
Thank you. Good, one more. Hold that. Yeah.
Hannah Hyde. Lori Hill.
Awesome.
Elagosa Ibinaweka. Lorencia and Betty. Abigail Johnson.
No, not there. Shake her hand. Abby.
Shannon Ledwig Johnson. Autumn Kennedy.
Now grab those lapels and kind of pull them in a little bit. Right there. Here we go. One more.
Nadia Siani.
That's okay. Good. And again, grab those lapels and just kind of pull it in a little bit. Pull it down.
Lindsay Curavilla Allison.
One more.
Rebecca Larson. Okay, if the third row will please rise. Sydney Levine. Michelle Shihun Lee. Grace McCraw. Alexandra McKee. Karina Mejia. Marie Angelique Merced.
Awesome. Here we go. One more.
Dylan Nguyen. Kevin Nguyen. Lin Song Thuy Nguyen.
One more.
May Cam Nguyen. Edson Omana. Nidhi Rana.
Here we go. One more.
Sydney Tharp. And Catherine Wakefield.
Here we go. One more. And look at me over here. You get your Good. No, go ahead. Doctor, look towards me too. Excellent.
All right, if you'll all be seated, yes, please. Thank you, thank you, thank you. Okay, we're almost there. The Hippocratic Oath was written in the 4th century at the dawn of human civilization, and over time it has been modified but retains the same key provisions. These include the principles of medical confidentiality and non-maleficence. Swearing a modified form of the oath remains a rite of passage for students today. Some of the provisions have been adopted for our profession and some updated for today's complex and more interconnected world, but all require your dedication to the profession, to humankind, and to think outside yourself. I'd like to invite Kathy Erdman, one of our faculty and former program director, to come forward and administer the oath while the students signify their acceptance of the oath verbally.
Okay, students, please stand and face the audience and repeat after me. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. These duties are pledged with sincerity and upon my honor.
Congratulations. Have a seat. We have one more presenter tonight. The Susan Mortensen Turley Scholarship for Excellence in Community Service is awarded to a first-year PA student who has demonstrated outstanding community service, and I would like to invite Alyssa Love to the podium to present this award. Okay, get set up here. Last but not least, okay. The Susan Mortensen Turley Scholarship was established in 2017 by Bruce Mortensen, a 2014 graduate of our BCMPA program. The award serves to memorialize his daughter, Susan Turley, whose life ended prematurely due to cancer.
Susan was remembered for actively seeking opportunities of service throughout her life. Described as a champion of inclusion, Susan always reached out to make others feel loved. This award recognizes an outstanding first-year PA student committed to community service. Specific criteria are that the awardee is in good academic standing, is dedicated to improving the community through outreach and service above and beyond curricular requirements, and has demonstrated superior qualities of leadership, character, integrity, compassion, and service to others. We're pleased that several students are nominated by their classmates for this award each year. This year's recipient is described by her nominators in the following ways, and I quote, "In our cohort, her influence is palpable. She effortlessly inspires those around her, leading by example with unwavering dedication and a genuine warmth that draws others in. Her ability to unite us during both mundane and challenging times, such as daunting finals weeks, speaks volumes about her leadership and character. Outside the classroom, her dedication to community service shines brightly. Despite being a mother and juggling numerous personal responsibilities, she actively participates in initiatives aimed at bettering our community. Whether it's participating in a 5K race for cancer last year or volunteering at the local food bank this year, she consistently finds ways to make a positive impact on those around her. But what truly distinguishes this nominee is her boundless compassion. She continuously inspires and uplifts all who have the privilege of knowing her, always putting others ahead of herself and her own needs. On behalf of the faculty, I'm pleased to recognize the recipient of this year's Susan Mortensen Turley Award, Lindsay Caravilla.
Congratulations, Lindsay. Thank you very much, Alyssa. Well, I would definitely like to congratulate you on a job well done this year. You have definitely walked a long dotted line that has probably felt like 13 months of a hurricane the whole time. As you've heard, you've been through countless exams, experiences, tests of multiple choice, but in person, standardized patients. And I would say you've definitely gotten comfortable being uncomfortable. And I'm most proud to say that you have always shown that you can be kind even in those circumstances. So as you move into your next phase of clinical learning, I hope that you continue to be you in that way, that you take advantage of all of your learning experiences. Remember that it is a team sport, and that you will provide so much to whatever is needed to take care of your patient. I have no doubt, and I will not take it personally, that the next 17 months of your training are going to be much more fun than this past year. I will miss seeing you here, but I'm excited for when you come back to tell us about all of the patients that you've seen, all of the experiences that you've had, and I wish you the best of luck. Thank you all for coming. Our students will adjourn to the Razor Lounge for photos, so I'd like for you to all congratulate them as they walk out, and they will meet you in the lounge once finished. Thank you so much. Lead the way. Thank you all for joining us. Feel free to